You're good.
Hello, I'm Dr. Zappaterra, and today I am interviewing Brian. Brian is a patient of mine who I would like to share his experience of some of the treatments that we've provided for him. I would like him to tell his story to provide some information to the audience in terms of what sort of reactions he had to some of the injections that we performed, so that some of the audience who's listening to this may actually consider some of these injections for their pain management as well. Brian, welcome.
Thank you.
Thank you very much for agreeing to be interviewed. You have a very unique case, especially amongst patients that I've seen. And I'm wondering if you could share with us sort of your history in terms of what happened to you, what sort of treatment options were you provided, at what point did you come and see me, why did you come and see me, and then we can go from there in terms of, what treatments we offered you and how you felt since then.
Sure. So about 5 years ago, I sustained an injury to my right foot while I was on vacation, and the injury was pretty terrible. It was a Lisfranc fracture to my right foot, and we had displacement of several of the joints and a crushing injury on one side of the tarsal. I had an open reduction internal fixation to try to correct it. I went through surgery for the fracture. The surgery actually went really well, and the post-surgical alignment of the bones was very good. We had hardware installed in the foot to hold it while I was recovering, and approximately 4 months later, we did hardware removal. After that, I began a course of physical therapy that probably went for 3 to 4 months, where I had to essentially learn how to walk again. I was very optimistic about my recovery at that point, but as time went on after the physical therapy, instead of improving, I noticed I was getting worse and worse. It was determined, through my x-rays that I had onset of post-traumatic arthritis happen really fast. Within 2 years after the injury, I was on pain medications. At the time it was Vicodin, and my function was declining over time to the point where the pain was impairing my cognition. It was impairing my ability to work as a professional. The pain was bad enough that it would impair my cognition, and if I resorted to taking the pain medications, that would obviously have an impairment on my cognition as well. The options that I was given at that point were essentially surgery or more pills. The pills weren't really conducive to a productive lifestyle anymore, and it was really becoming a threat to my profession. Either being on or off the pills is the only option. Surgery wasn't acceptable to me at the time. Having gone through 2 surgeries already, it was brutal. The recovery was absolutely brutal in terms of the pain and the loss of function. So I was really loath to jump back into surgery, especially since what was being recommended was anywhere from a partial fusion of the joint to a total fusion all the way through the ankle, which just really scared me, to be honest with you, in terms of how much I might lose as a result of the surgery, and nobody was promising me any positive result necessarily. So I was getting pretty hopeless, frankly, about my function moving forward. About 3 years after the injury, I was at the point where I was walking on a cane 100% of the time. I couldn't really get more than a couple hundred yards even with the cane. I had basically stopped driving almost entirely because it's my right foot. And I didn't see what was left in the future for me in terms of improving my functionality. And that's when my search started, that ended with finding you. At some point, my orthopedic surgeon said, I can't just keep giving you these pills. You need to find a pain management doctor and explore other options, or at least have your medications managed in a more aggressive setting. So that's where I was before I found you. when I came here, the reason I actually ended up with you is I made a lot of phone calls and did a lot of research. When I was sitting in your waiting room, I was reading a case study. You had a binder full of studies, and one of them was an anecdotal case study about a patient who used lucid dreaming to overcome chronic pain. I had been kind of experimenting or reading myself through what alternative things could be done to manage my pain. I had read about burn victims using virtual reality, kind of going into icy caves, and it really opened my mind that a lot of what's happening with pain management isn't just physiological, that there's a real psychological and a mental component to it as well. So seeing that study, I kind of felt this is this is the guy that I can talk to. And I remember our first conversation was, I don't want surgery and I don't want pills. What else do you have for me? And that's when we started going through the different treatment options.
So what we actually did at that time was, we offered Brian some treatment options in terms of, the discussions that we had. And there are numerous options in terms of what we discussed. Some were simply continuing with the medications. And there were a couple options, in pain management. I never like to promise anything. We never know how anything is going to affect a patient, either with side effects or with efficacy. And so, one of my philosophies is sort of, we try and see. And so I know that we talked about a couple of things. One seemed to resonate with you, which was performing Traumeel injections. And Traumeel is essentially an arnica-based homeopathic solution that has been injected into joints, tissues, muscles, extensively here in the United States and also in Europe. And so, we offered that to Brian. We also offered some things like prolotherapy, which is an injection of high concentration of dextrose or sugar, essentially, which is called prolotherapy. We also offered him platelet-rich plasma injections. These are where we actually spin out the platelets and inject the platelets into the joint or tissues. So in the discussions and talking about sort of the various costs as well as the possible effects of the treatments, Brian chose to go with the Traumeel injections. So could you tell us, you had your first Traumeel injection. Do you recall when that was?
It's probably about 2 years ago.
Okay.
Yeah.
So he had his first Traumeel injection about 2 years ago. And so could you tell us sort of how you felt and then how your life has been since then?
I was in a really bad place at that point. I was pretty hopeless in terms of the pain and the treatment options. So I had also slid into depression, which I know is not uncommon for chronic pain patients. That day I actually remember pretty clearly. I remember I hobbled in on my cane, as I would every day. What was different about that day is that after we did the injections, I walked out. I didn't hobble out, I didn't limp out, I walked out. I couldn't believe that for me the effect was almost immediate. My foot was just a little bit tender, but there was immediate relief. And after that we started kind of playing with the frequency of the injections. And over maybe the next 6 months we settled on a schedule of an injection or a series of injections every 4 weeks. We pushed it a little bit longer and I found that it kind of fell off a little bit in terms of the pain relief. We tried a little bit shorter and the 4 weeks for me turned out to be really great. So in those 2 years since we've been doing this, my improvement has been a steady line straight up into the air. I haven't been on the cane now for probably almost a year. I've been off the cane. I drive everywhere now. I'm able to do that without pain. I walk without a limp. I think when I first came to you, my average pain level was probably a 7 or an 8 every day. And like I say, now 2 years later, I'm probably at an average pain level of a 2 or a 3, which was beyond my expectations in terms of what kind of response we could get. I still have the prescription for Norco now for times when it's really bad, but at this point I probably haven't reached for that bottle in at least 2.5 months. So it's really hard to overstate how hopeless I was in terms of my function before and how much I'm able to do now. I didn't think I'd ever be back at this spot.
That's fantastic. And so, one of the things that we always go for is function. Could you tell us sort of what other activities you've done that have increased?
For sure. I was doing nothing, obviously, 2 years ago, except the bare minimum that I had to do for work or social. I tried not to put any more use or abuse on it than was absolutely necessary. Now my life has returned to almost completely what I would call normal. So when I have to walk long distances, I'm not afraid to do that. When I do it, I'm able to accomplish it. Running and jumping are probably a little bit beyond me for probably forever, but I've been able to get back outdoors. I love to travel, I love to hike. I've done hikes now that are up into 3 to 4 miles. I literally never thought I would be able to walk that far again, especially over uneven surfaces. So as far as I'm concerned, there's nothing that I'm held back from anymore that I want to do. It used to be that the foot dictated what I could do, and now I dictate what I can do. So to be able to regain that power and still have a clear mind it's completely transformative for me. It's I hope I'm not overstating it when it says it really kind of saved my life, or at least the life that I expected to have. At a young age, I mean, I was mid-30s, early 30s when this happened. It felt unfair to me that I wouldn't be able to do all of the things that I expected to do. And that was really upsetting to me. I really got caught into that it wasn't fair, that I couldn't do this, and that I wasn't in control anymore. So to be able to have something that put me back in control of my life, but didn't offer really any compromises on the con side, it was just an absolute gift. And I thank you for it.
Well, we thank the medicine. Do you have any final thoughts or comments?
Yeah, I think that it's a really long road, and patients with chronic pain know that they have to be responsible for a lot of their own care, and they have to do a lot of work to find their own way through. Every patient is different, every body is different. I was fortunate enough through a lot of hard work to find a doctor who shared a similar vision for my treatment with me that gave me options to do that. But there are other things out there. What I learned is there's not just knives to cut you and pills to numb you. There are a lot of other things out there that can be done. And I think one of the things that we've also talked about a lot is there are things that we can do physiologically to help alleviate the pain, but so much of pain management is psychological and emotional. So if you can tend to yourself and to your psyche and stay positive, you're going to end up with much better results. So if you can fuel a positive physical response with a positive mental response, you can have an awful lot back that you thought you lost. So I just want to encourage people to fight. Pain makes you hopeless, but there is hope. There are treatments and there are doctors out there that can give you a level of function that maybe you thought was lost to you. And if anyone is proof of that, it's me. I'm back.
That's great.
Yeah.
Thank you.
Yeah.
And so I just want to finish it with one final. And so, we never know how people are going to react to certain treatments. We never know how long, if people do react to those treatments will last. But in pain management, we're trying to offer patients, even having 10 or 20% chance of some improvement. And so I feel like our job is actually, to scour the literature, to look at the research that's going on, especially in today's day and age in terms of the complexity of chronic pain management, and to be able to offer patients like Brian treatment options that, you know, may not be sort of first line or second line or even third line, but ones that are safe, ones that don't have side effects, and they might get better. They might have some improvement, and I think Brian is a great case of, you know, some improvement with using injections that are not mainstream in the United States. And so the other thing that Brian touched upon is, you know, the mental and physical aspects. So we try to take it from a biopsychosocial approach, you know, looking at the physical as well as the psychological, the mental, and even the spiritual. So I thank you again,
Thank you.
and that's it.